Good afternoon. My name's Kevin Kirkpatrick. I am the CEO of Avery Talent Advisory and host of Physicians Who Lead podcast. Today, my guest is Dr. Seth Glickman. Dr. Glickman started off in emergency medicine, has become an entrepreneur, a physician leader, and is now an advisor. So pretty diverse career. So how about we start with you talk about your career path to this point?
Yeah, sure. Happy to. Great to be with you, Kevin. And you did a really good job introducing me. I've had a lot of different roles in healthcare. And I think the theme to my evolution as a physician and a leader has been that I started as a clinician really centered around the patient. And as I progressed in my career, it's been about how can I have a larger impact on how we're delivering care and how accessible and affordable care is to the people that we serve. And so I started out as a clinician. I worked in the ER. I trained in inner city in Chicago, and it laid bare all of the dysfunction in our healthcare system. It seemed like everything was backwards. We were paying for people when they were really sick and it was too late to really make a difference. And I used to see a lot of people with accelerated or end stage hypertension at a really young age come crashing into the ER requiring hemodialysis. And it really got me interested in this notion of population health and value-based care and getting more upstream and keeping people healthy and creating incentives that really align the different stakeholders in the healthcare system. And so wanting to have a bigger impact and being really interested in health policy, I ended up in leadership roles leading the transformation in how we deliver care and how we pay for care in large healthcare systems. I also spent some time on the insurance side, and that gave me an opportunity where I could have an impact not just at the individual patient level, but at a much broader level in the communities, in the states, and even multi-state regions where I was practicing. And now, as my career has evolved, I do a lot of work with clinical leaders, especially executive coaching, because it's a way to really continue to amplify the impact that I want to have on healthcare. So I went from being an individual clinician to somebody who was leading large teams of people and delivering care for entire systems to now I coach physician leaders who are at multiple systems. And so I feel like it's an opportunity to bring what I've learned and to really give physician leaders the skill sets that they need to be effective in the work that they're doing. And also involved in some advocacy work in DC, which also gets to the heart of how we make our healthcare system better and more affordable.
One of the things that I often get asked about is that transition from clinician to leader and stuff like that. So how did you go? Like, how did you go from one to the other? And did you take any courses? Did you have a mentor? I mean, what was that? What was that transition like?
Yeah, it's a really important question because some physicians stumble into leadership and some are a lot more intentional about their efforts. And so I differentiated as a physician leader relatively early in my career. And part of it was I was fortunate to have great mentors and advisors. So the chair of my academic department at UNC was very supportive of me seeking out and pursuing leadership opportunities. And I also had a good mentor and advisor who was the chief physician executive at UNC Healthcare, where I spent my early days. And so it started small, where I was given assignments or opportunities to really work on areas that were of interest to me. And at the time, that was population health and value-based care that were also aligned with where the system was investing resources and needed really good people to develop strategy and also implement those strategies. And it was a very iterative process because you have to sort of earn your stripes when you're a clinician who's transitioning to becoming a leader. So over time, I gradually, as I demonstrated my ability to do that work effectively, I was given more and more assignments and opportunities. And so it was really a glide path, I'd say, over a period of about 10 years, where I went from being entirely focused on clinical medicine to a period about a decade later where I still practice medicine, but really 90% of my work was leading other physicians and doing the business work of how to make the system work better in a large system. And I think several of the places where I spent time, Intermountain's a great example, also were intentional and had resources available for physicians who wanted to be leaders. So formal didactics and training that I think was important for me in developing some of those leadership skills.
What were a few of the biggest changes or challenges that you came across from physician to leader?
Yeah. Well, no shortages of challenges. So, but if I because obviously being a leader in healthcare is hard, and I think it's especially hard for clinical leaders because we obviously are trained to take great care of our patients. And I think one of the main challenges that I face, that a lot of clinical leaders face, is how to develop the skill sets necessary to really be effective and pragmatic business leaders. And those end up being a lot of things around how do you influence effectively? How do you work as a team? How do you manage or resolve conflict in a productive way when it comes up? And a lot of that is about how you work in a very matrix organization, whereas in our clinical training as physicians is very hierarchical. And when you're the attending physician, you run the show and you quickly realize when you get to a C-suite and you're dealing with a lot of other both clinical and non-clinical leaders that you have to lead in a different way. And so those are, I think, some of the challenges that I faced and that physician leaders faced in making that transition.
And it's interesting because in the several months that I've been interviewing physician leaders, those are the things that come up on a repeated basis, right? Where changing the way of the line of communication from being the authoritarian to the influencer. The other one is the pace, right? Like a lot of people identify that you're used to dealing with a clinical issue in the moment. And yes, it might take days for that patient to recover and be discharged, but you have an urgency and then then it moves away. But in healthcare, you might still have urgency, but it may take 6 months, 12 months to make that change. How did you
Yeah, I think you raise a really good point because a lot of it comes down to the process of how one makes a decision, and really it looks different when you're in a business setting versus when you're in a clinical setting taking care of patients. And so maybe just to sort of bring more light to that issue, when it has to do, I think, with making or how do we learn how to make decisions with imperfect information, and also how do we learn to trust our intuition and our gut and have that be part of how we guide ourselves through decision making. When you're a clinician, so much of how we make decisions is based on facts and information. So we order lab tests and we order imaging tests and we get consultations from other providers and we synthesize all that information, and usually the answer is pretty clear and apparent, and there's evidence and a history to support what decisions we make about a treatment that a patient may need, or do we discharge them to home or to some other setting. When you're in a business setting, you realize that you need to use judgment and intuition and balance that with the facts that are available, and sometimes you don't have all that information that you need. And so I think developing the comfort level and skill to use judgment in that way, and also to trust oneself in making those decisions when you're new to a leadership role, is something that doesn't come naturally, and I think takes time and experience to build that muscle.
Often the structures are that the physician leader is a representative of the physicians and works with the corporate leaders and CEOs and stuff like that. I've had instances where I've worked with organizations and there's a bit of a disconnect there. But how would you encourage someone to build a relationship with corporate leadership and build between the physicians and corporate leadership? Because sometimes, when you go from worrying solely about one patient, the perception to looking after the system is potentially going to create conflict. How do you work through that?
Yeah, I think you hit on a really important part of that. It is about building relationships. And when we are going through our careers as clinicians, oftentimes we find ourselves in leadership roles because we've really become an expert, or we've mastered the domain of a particular specialty or subspecialty. When you're in the C-suite, it can feel very isolating because all of a sudden you don't speak the language of the CFO or the chief human resources officer or the CEO or the chief strategy officer. So I think part of it is clearly investing in building relationships with those individuals. And I think also having this mindset of constantly needing to learn and to put yourself in the shoes of those individuals and learn how to, what the vocabulary of the CFO is and what are the things that are most important to them. And then I think it's through that shared perspective that you can really begin to build meaningful business relationships and really align in efforts, and you quickly realize that the system is much bigger than yourself and your domain as a clinical leader. So I think those are some of the areas that I would encourage any physician leaders out there to really spend a lot of time.
Yeah, it's definitely a big focus on the interpersonal and stuff like that. And, we've talked here about the challenges and the things that you need to learn. What are the things that have brought you joy in moving into leadership? Like, what things are you proud of the most?
I think a couple things. One is the interactions and the building lifelong relationships that have served me well, both in those roles and beyond. So I become great colleagues and lifelong friends with people I really wouldn't have ever interacted with in a meaningful way had it not been for my work in leadership capacities. So I have a great friend who is a chief analytics officer and another great friend who is a chief information officer. And I think developing those relationships and also creating that shared perspective that I mentioned has been really important. And then I think beyond the individuals, it gets back to that topic that I talked about at the beginning about the ability to really have a much larger impact and start to shape the policy of how our healthcare system works. And right now, a lot of the work that I'm doing, in addition to executive coaching, is spending time on the Hill, meeting with legislators, getting involved in advocacy work, working with policymakers to help shape legislation, and then really seeing how that's impacting healthcare on a level that's more than just how care is delivered in the clinic, but how healthcare is delivered in communities and states and across the country. And so I think that's been one of the really great things for me that has been a byproduct of being involved in leadership work.
Excellent. Thanks for that. One of the other things that we talked about in the past was your identification of a problem and then the entrepreneurship that came along with that. Can you tell the listeners a bit about your entrepreneur journey?
Yeah, absolutely. So I started and scaled and eventually sold a healthcare software and analytics company. And we were focused on ways to really innovate around how we were measuring patient experiences in healthcare and feeding that back to providers in a way that supported their quality improvement and patient safety efforts. And a lot of it was how we leveraged technology to do that better. And what's really neat about that experience was it started with an idea at the time. My mentor, a gentleman named Kevin Schulman, I was meeting with him in his office, and I was really frustrated with the status quo of how we were doing pen and paper surveys, and the information wasn't timely and it wasn't actionable, and it wasn't really well embraced by providers because of all of these shortcomings and how the process worked. And so we actually whiteboarded what an ideal solution would look like. And maybe at the time I was a lot more naive and I thought, well, heck, I'll just go build it. And he actually encouraged me because we were both excited by the idea to build it. It was a labor of love for the better part of a decade and taught me a lot about entrepreneurship. And I think it was also a great lesson for me that I think a lot of physician leaders can really not only create opportunities for themselves, but make the world better when they take on really big problems and they bring solutions that really transform how we think about how we deliver care. And so maybe one of the lessons that I would share with other maybe early career physician leaders is if you see a big opportunity or a big problem, don't be afraid to go out and try and change it, because I think a lot of opportunities for growth as physician leaders are really rooted in big problems that need to be solved that other people haven't figured out how to solve as physician leaders.
It's interesting because through my LinkedIn connections and stuff, like I see a lot of physicians. I've connected with a lot of physicians that are are entrepreneurs and stuff like that. And it's interesting because over the last 20 years, I've had companies reach out to me, and predominantly because they think I can introduce physicians to them, right? So it's very self-serving. And often when you ask them, about physician involvement in the technology or in the service and solution they want to provide, it's limited. And I always thought that was a bit of a recipe for failure, right? Is that if the person that you're selling to isn't involved in identifying the problem and the solution, is it really going to be something that they want, right? Or is it really going to be designed for the person that's going to use it? And I think that, much like getting more physicians in leadership roles, like getting more physicians developing solutions as well from the lens of the clinician and the lens of the patient is paramount, right? And that's probably why you were so successful too, is that what you were developing was something that would be used and adopted because it made sense, right? And too often pushing technology on people, whether it's for reporting or for financial aspects, doesn't really benefit anybody.
Yeah, it's a really great point. And I have a lot of friends and colleagues who are physician leaders, chief medical officers, and even CEOs at technology companies. A lot of them are investor-owned companies. And I think one of the reasons that works so well is the ideas and how those ideas evolve, including particularly from a technology perspective, are really born out of the actual experience that they have of delivering care to patients. What are the challenges? What are the opportunities? And I think it's so important and a great lesson for why physician leadership is really critical to the success not only of venture-backed companies, but established organizations, because it's really hard to engage a clinician workforce or really get them to embrace solutions or new technologies unless they really sense that, or you can prove that it actually was developed for the purposes of really improving care and addresses all of the pain points that clinicians who are doing the work in the trenches really have. So it always works better that way than when it's top down or from outside in.
Well, and it's interesting too, because I worked with two technology companies to recruit physicians in the last year, and we were able to recruit probably 18 physicians within a 4 or 5 month span. And a lot of it was due to the fact that it was interesting work for the physicians, right? And I think creating something that a lot of the times it's part-time, so it's not like they have to give up their clinical career. Maybe they practice one day less, but they align time for those other initiatives. And I think that often allows a break, right? And a different perspective and a refreshing break from from the clinical that allows them to continue to do clinical longer and stuff like that. And I think that, to relate it back to leadership is, I think if we start making leadership more attractive to physicians as well, then it won't be scenarios of people falling into it. Or, I've heard people say that they were the last one to say no, and because of that, they became the medical director, right? So, and I found that, the ability to attract people is by offering something that is something they would want, is a lot more successful than trying to hire somebody for something nobody wants. Right?
Yeah, exactly. And I think just the realities, medicine is becoming more and more challenging to practice, and the levels of burnout are at really shocking proportions. So I think thinking holistically about a physician's career and how leadership, or even we talked about opportunities on the technology or venture front, but opportunities to advise or be a part of other activities that really round out the portfolio of what physicians do, and I think really tap the core of why we went into medicine and how we can improve the overall practice of medicine. I think those types of opportunities and leadership is certainly a big part of that, are going to be increasingly important to ensure that physicians stay engaged in the practice of medicine.
Yeah, and it's interesting because I would say anywhere between 4 and 6 times a week, I get talk to physicians, and the purpose of the call is not about a specific vacancy or anything like that. It's a lot of it's almost like career planning, right? Like where someone's interested in doing something different and getting a break, so to speak, and they want to understand how they can do that, but they also want to know who they should be talking to, right? A lot of times it's a case of, I talked to a physician yesterday who wants to do more in occupational medicine and insurance, and it came down to strategizing uh, what their career plan and job search and stuff should be, right? Some cases
Yeah.
it's proactively marketing them to past clients of mine or potential new clients, and other times it's just talking about how to network and express their value to people. And I think too often we don't realize that physicians train for so long that the variety it's a very there's a lot of different things within their training, right? It's not you don't become a family doc in 6 years of only family medicine, right? You see a lot of other different things, so the transferable skills are massive, and if we can coach physicians around the things that are different, then we open more doors, right?
Absolutely. Yeah, I can't say it better than you just articulated.
Nice. Doctor said I articulated it well. Awesome. The advisory stuff and the coaching and that, what does an average engagement look like? Like, what problems do you help solve?
Yeah, well, I'd say there's no two engagements that I work on with physician leaders that are exactly the same, because everyone is really predicated on what are the most important issues for that individual. A lot of it ends up being situational, based on what is the most pressing thing that a leader needs a coach to help them figure out at any given time. So it may be a career transition, it may be you're considering exiting an organization, you're having real challenges maybe with your boss or the board or other C-level executives. And so what I do is work with people to effectively enable them to navigate those challenges. And I think another big part of coaching is also really developing a foundation for a leader to understand at their core, what do they stand for, what's their personal mission, vision, values, and how to use that to really guide how they show up as a leader and how they make decisions. I think that's a really core part of the coaching work that I do. And then beyond the addressing whatever is on fire at every given moment, also trying to take a step back and really be intentional about the career of a physician leader and creating goals and figuring out how to help people achieve those goals and not let fear get in the way and accomplish great things that excite them. So I get a lot of joy out of that work, and it's a big part of what I do now. And I also benefited from having great executive coaches, and I think that was a big part of my leadership effectiveness. So in a lot of ways, I feel like I'm giving back and really trying to support an entire generation of physician leaders and in making healthcare better.
Nice. It's interesting because I think our initial interaction on LinkedIn was around the transition and supporting physician leaders and physicians as they transition into leadership. We talked about, and we were going back and forth on a post about, ensuring that the job was adequately reflective of what it was actually going to be, and then support in the role. And it's actually led me since then to dovetail coaching with my placements. So if you come to me for a CMO, and I've been aligning that candidate once selected with a coach for several months to improve the onboarding, to give them that person to go to, because if there is miscommunication with the CEO, then it gives them a sounding board. And I think it's an opportunity to expedite how quickly they'll get to being fully effective. But also, I'm hoping that it increases the retention, because the retention for clinicians in leadership roles is less than that of corporate, right? So that means one group is staying longer than the other. So, you want to balance that out by increasing the retention, right?
Yeah, I think you are on to work and doing work that is so critically important, and I think it also, unfortunately, in too many cases, is an unmet need. And I can remember taking on new leadership roles in organizations, and it's doubly hard because one, you're oftentimes moving your family and you're settling into a new community, and there's all that, the typical stress and challenges of adapting to a new organization, a new community. And then from a professional standpoint, we talked a little bit about how physician leaders can really feel isolated,
Mhm.
especially as they ascend ranks and all of a sudden they are part of a much larger group of people who maybe don't speak their exact same language or think about issues the way they do. And so these challenges really can come to a head. And I just remember, in some of the roles that I took on, feeling pretty lonely and a bit isolated and not having that support structure to help me with that transition. And in hindsight, I would have really benefited from that. So I think that's really important. And then, beyond the initial 3 to 6 months, I think having longitudinal coaching relationships can also benefit physician leaders. One of the areas that I see really uh, that where physicians can benefit that from is, how do you continue to lead without losing yourself? And very often, a physician leader's core values or morals may come into conflict with the duties or responsibilities of the role, or how maybe other people in the organization are viewing the same issue. And, a coach can be really helpful in being a sounding board and also helping leaders develop a framework for how they make decisions when, their personal values may be in conflict with what they're being asked to do or required to do in their role. And so, I think it sort of speaks to the importance not only of the work that you're doing at the time someone's hired, but continuing to, support them during the formative phases of their role, which is definitely the, first 6 months to year, I think.
Well, and the other piece too, and I've had this discussion with physicians as well, is like I think of a CMO search that I did where they had they had tried to recruit themselves, and while they tried to recruit themselves, they had an interim CMO. So we came in late to the game, identified multiple really strong candidates, and it was a rural area. So relocation was going to be a challenge, but we had people that were interested. And when they went through the interview, there was concerns about relocation and concerns about fit. So they decided that the interim person was a better option for a lot of reasons, but there were challenges around the leadership piece, right? So
Mhm.
in that scenario, we pivoted away from okay, we're going to recruit somebody to we're going to develop somebody, and I brought in a consultant that worked with with the interim physician into the permanent role and supported them through the growth to assume it, because it was the right decision at the time, because the person versus people that you don't know, and it's a retention thing, right? Like, who
Mhm.
knew if that individual would stay if someone else came in above them and toppled the apple cart a little bit. And the other part that I've heard too is that coaching through the notion of going from a peer to the leader with the same group. So the doctors that were your peers, the week before, now all of a sudden you're responsible for representing them and leading them. And, I think I've heard a lot of people struggle with that transition, right?
Yeah, that is a hard transition when you all of a sudden are responsible for managing your peers, and also gets to the part about the conflict with, your personal relationships and how you may feel about a situation because it's impacting a small number of people or individuals that but you also have a broader duty or responsibility, as a system leader. And that can be really, really challenging. And there's another reason that physician leaders, I think, can feel a bit isolated. And you also hit on another area which I think is important about, you mentioned the folks doing their own internal search. And I think one of the areas where I know the work you do is really valuable is really helping optimize fit and trying to bring an objectivity to the process about what is required in this role, and then how do we really understand or assess a physician's fit for that role. Because very oftentimes you can have the best candidate on paper that's a complete mismatch for a given role based on how that role is structured or who that role is reporting to. And I think sometimes, when we're the people closest to those roles or those hiring decisions often, unconsciously or sometimes even consciously can bring their own bias or kind of perspectives to the issue. And that's where I think, the work that you do and other firms like you to try and help clients make the best hiring decision is so important. And I think it's also a place where it seems like we go sideways all too often. And I think that's one of the reasons. If you wrote an article for Doximity a couple months ago about the turnover rate for physician leaders in the C-suite, and the average CMO has a tenure of less than 2 years versus almost a decade for other C-level leaders. And part of it has to do with a lot of the issues that we talked about in terms of the skill sets that physicians need to acquire, which sometimes come later, and then making sure that when we really elevate physicians to leadership roles or hire them from outside, that we're really thinking about the fit. And, where the fit doesn't work, we either shouldn't be hiring that candidate, or we should be going in eyes wide open that this is the support that they're going to need, because they're likely to encounter challenges around, certain areas like their ability to effectively manage and motivate a team. And that's where we should be applying those resources. So there's just some ways I think about where some of the opportunities lie to make better hiring decisions and also support physicians and roles.
Yeah, it's interesting. I can usually tell the success of a client early on in the process, and it's usually based on how well they communicate and define what they're looking for, right?
Mm.
And like, I've had clients that send you a job description and say, "This is what we're looking for, and here's the salary. Let me know." And it's like, well, hang on, like, I've got questions, and if I've got questions, then the physician leader who knows that more is going to have even more questions. Let's talk about what it is we're looking for. And, on average, a good debrief takes 2 to 3 hours of discussing it, because when I look at making a connection, I look less at, degree to degree requirement, years of experience to years of requirement. And as a headhunter, I've always focused on what's the problem right? Like, what things are we trying to accomplish? And let's find the person that can accomplish those things while fitting well with your mission and vision and values, right? Because someone can be a great clinician or they can be a great leader, but if they don't fit and if they can't identify and help you meet whatever your goals are, then it's not going to be a good fit. Right. And I've been spoiled that less than, I think it's 2 times in 17 years, I've had issues with placements. One, the person had a heart attack, which had nothing to do with me. I promise I did not cause his heart attack. So I had to replace him. And then the other one was just miscommunication because they hired someone part-time and thinking they were going to go full-time and they never went full-time. So luckily for that, I mean, in 17 years, it's not a bad thing, but it's because I'm not the fastest, right? Because speed and the perception of desperation, is toxic for the process, right? So I like to ensure that we've got enough candidates that we're getting a full view of the market, and B, take enough time that you understand who it is you're hiring and they understand who you are, right? When someone comes back and says, I'd like another meeting or I need some more information, I always tell them my job is to get the client to the point where they have an unreserved decision that yes or no. And the same is for the physician, right? Like at the point where I want them to be all in on yes or all in on no. And no's great too, right? Because the last thing I want to do is have to replace somebody because they said yes when they should have said no, right? Because I guarantee my placements for a year, right? So if they're not there in 11 months, then I have to replace them. And that creates all kinds of upheaval for the organization. It can derail organizational projects. Like it's bad for the culture. So, slow and steady wins the race and ensures that you get the right person for the right time doing the right things. But that takes communication, right? And that takes the notion of, sometimes the notion of an outside lens saying, this is what you think you need, but have you thought about this? And this is what they're offering. Have you thought about that? Right. So, it's a bit of, a translation, right? So that's good from that standpoint. So I was great to talk to you. And luckily we've had conversations before this. So I had some ideas of what we could talk about. If somebody wants to find you, is LinkedIn the best way to find you? Or do you have a website that you want to share?
Sure. LinkedIn, people can find me. Also, I have my own website, SethGlickmanAdvisors.com, and happy to network and talk with anyone that's interested in talking with me or learning more about what I do. And yeah, that'd be great.
Yeah, and I would encourage people to follow you on LinkedIn because there's been some great conversations and back and forth because you're pretty active there and active in the sense of adding value. So, that's how we connected. So I appreciate you taking the time to talk to me today, and have a great rest of your day.
Thanks. You as well, Kevin. And thank you for the work that you do and also for the podcast work that you do to get the voice of more physician leaders out there. So thank you.
Thank you.